Hi, my name is Ashley Brown, and this is my video portion of my brand application where I'll be going through the 5 questions listed. First being, how did you handle a situation where a classmate or peer was engaging in unethical behavior? I will answer this question honestly and say that I have not been in this situation before. However, if I were to come across a classmate engaging in unethical behavior in an instance where they were using outside resources or cheating on an exam or assignment, I would pull that classmate aside and talk to them privately about it. Ask them maybe if they are struggling in the class, if they don't have the right resources, and if this is the case, I would offer my help to help them succeed as well. And if this issue continued, it would definitely have to be brought to a professor or a higher up, as academic honesty is what keeps the strong integrity of a program and a university as well in a whole. Um, so it's just very unfair if a classmate is cheating and the rest of us are working very hard to maintain our grades in this program. So definitely something would have to be brought up. Um, if I had ever encountered a coworker being unethical, for example, if I witnessed a coworker breaking HIPAA, I would automatically bring this to my supervisor with my concerns, and I would not hesitate to speak up, as this is not tolerated in the workplace at all. Especially where patients are involved, our priority is patient safety and patient privacy, and nursing is a very detail-oriented and attentive and very respectful career that any unethical behavior like this should not be tolerated whatsoever. For the second question, how do you work in a team environment and tell us a time you collaborated successfully with others? One of the biggest things I take pride in is being a great team member. At the Cancer Center, I am more focused in the infusion room where teamwork is vital to keep things running smoothly and efficiently. So, the biggest role I have as a patient care tech is helping nurses with anything and everything. I demonstrate this by performing tasks that they delegate to me and rooming their patients in a timely manner and getting their weight and vitals. And this is very important, especially when the nurses are busy, that they have their patients already in a room set with vitals and make sure they're comfortable and everything. So this is very important in the teamwork that we have in the infusion room. Another way I demonstrate teamwork is if a nurse is very busy with another patient or other tasks and they are assigned a simple lab draw or phlebotomy, I will offer to take that patient, or I'll just take that patient to kind of lessen the workload of the nurse that is super busy. Another way I demonstrate this is I work very closely with other patient care techs in the cancer center, especially in the medical oncology office. I receive patients for lab draws that see a provider later on in the day, and I will work with this other patient care tech to kind of communicate with them what's going on with this patient, if they have any concerns, their blood pressure is a little low, anything like that, and kind of keep them up to date if their labs are running behind for the provider and whatnot. So, it is a very big team-oriented job, and we are successful at it, and it really keeps things running very smoothly. And I'm very honored to work as part of that team. For this next question, share an experience where you received unexpected feedback from a supervisor or coach, and what was your reaction to this feedback? So, working in the cancer center and being the one who does a lot of the lab draws, mistakes do tend to happen, whether a sample is hemolyzed or a lab is missed and the patient has to be poked again. And one way we deal with these situations is talking about them in our morning huddle under something we call reporting and learning, or RLs. And the first time I have ever been really part of that is um, a time where I had missed a lab that this patient really needed, and this patient had to be poked again. So there was some kind of negative feedback on that. However, me and my supervisor had talked about it and discussed ways to prevent this from happening in the future. And my initial reaction to that first part of the feedback was a little negative, especially on myself and internally, that maybe I'm not cut out for this. Maybe I am just gonna constantly make these mistakes and there's no way to really fix them. And again, after talking to my supervisor, we came to the conclusion that we're going to implement some processes on how to prevent this from happening. So, for example, I will go through and check providers' notes to see what labs they were expecting to be collected, and now I've changed kind of my perspective on these types of feedbacks. Instead of it being you are in trouble or you have made a mistake and you can't fix it, it is more of a learning process and a way to help us better ourselves and to prevent these mistakes from happening. And since then, these mistakes occur way less often, and it has definitely switched my perspective on this type of feedback for sure. For this next question, tell us about a time when I have demonstrated empathy and strong communication skills. Every single day I work in the Cancer Center, I routinely demonstrate empathy and strong communication, and I would be very unsuccessful in my job if I didn't constantly use these skills. But a specific example I can think of is when I was assigned a patient who was newly diagnosed with cancer and hasn't even seen our oncologist. I was their first interaction before beginning treatment with any members of the team. So during this lab draw, I got to know this patient pretty well, and they had became very vulnerable with me and expressed their fears about their diagnosis and the treatment they will be going through. They had informed me that their patient was, or that their cousin was diagnosed with the same type of cancer 10 years ago and unfortunately had passed away. And so those fears and vulnerabilities came out in this patient. I tried my best to reassure this patient that not only has medicine in general, but oncology research and treatment has come a long way since 10 years ago, and that we are going to take care of him the best that we can without any promising outcomes. Um, I was I communicated this with the care team of this patient that this patient is very concerned and anxious and might have a lot of questions and will need a lot of support through all of this. And this was very successful in the end. Providing that information was very beneficial as this patient went through treatment with all the support that they needed and ended up in remission. And it was a very happy ending. They got to apply to these Ivy League schools that they were really wanting to apply to. And in the end, it was just a great outcome communicating, having that empathy, and then communicating those concerns to the care team of this patient. For this next and final question, I chose to answer, why should we admit you over other applicants for our nursing program? I believe that my education and my academic journey and my patient care experience, as well as my dedication to providing quality patient care, makes me a valuable applicant. The upward trend in my academic record shows great improvement from past courses. My resilience, my change in study habits, and my priority to self-care has really set me up for success for the higher level physiology and biology courses that I excelled in. I began implementing different study habits such as active recall, creating my own study guides, and creating my own practice exams, methods I would continue to use to succeed in the program and even collaborate on with my classmates. Not only would I exceed academically in this program, but I believe I would make an exceptional nurse. I have gained a lot of hands-on experience being a patient care tech and receiving my CNA license. I'm proficient in hands-on skills such as performing lab draws and therapeutic phlebotomies, which I feel would help me advance to more advanced skills. I've also gained skills in communicating with the healthcare team and a variety of patients, working in a fast-paced environment, and showing compassion and empathy towards my patients. Lastly, I am dedicated to providing to the program itself. I'm very eager to collaborate with other future nurses with the same passion as me and to represent the program in a professional way. The program aligns with my values as I am a disciplined, motivated, and independent individual, qualities you are looking for in an applicant. I appreciate the time that you took to consider my application, and I cannot wait to begin my nursing journey with you. Whether it is this year or the next, I'm excited to pursue a career in nursing at the University of Wyoming.